Okay, I'm going to continue with the non-gonococcal genitourinary infections. So the most common after the gonorrhea in the United States is chlamydia trachomatis. That causes chlamydia. In this case, the causative organism is the serotype from D to K. And diseases in males include they have exactly same symptomatic characteristics as the gonorrheal. There's nothing you can differentiate them from. The only differences in case of the chlamydial infection is that, as you remember, there's septic arthritis in gonorrhea, but in case of the chlamydia, there's reactive arthritis, also known as Reiter syndrome. And in case of the neonatal complications, we have inclusion body conjunctivitis compared to the ophthalmia neonatorum in gonorrhea, and we have inclusion body pneumonia as well, which can develop to the infants that were born to the mothers that were infected with the chlamydia. Now there are other serotypes of the chlamydia as well, which cause a specific urinary tract, the genitourinary tract infection known as lymphogranuloma venereum. So this is caused by Chlamydia trachomatis species, serotypes from L1, L2 to L3. And it's usually, patients are usually co-infected with the HIV. And lymphogranuloma venereum is a chronic infection characterized with the genital ulcer, with the painful lymphadenopathy, and proctitis, with bloody stool and constipation. And then there might also be an edema of the groin and legs, also known as elephantiasis. Okay. Now let's talk about the syphilis, which is the biggest topic in here. So syphilis is caused by Treponema pallidum, which is a spirochete. It's like a spiral-shaped bacteria. Now, with the infection by Treponema pallidum, there's usually 2 weeks of asymptomatic phase, followed by stage 1, which is known as primary syphilis, right? When the person got infected with the syphilis, after 2 weeks, they develop stage 1 primary syphilis. So this stage is characterized with the painless lead-colored ulcer, known as syphilitic chancre, also known as hard chancre, because there's also another chancre caused by other genitourinary tract infection, and they call soft chancre, the one that caused by Haemophilus drucei or something like this. In the genital area, we have this, not we, but patients affected with syphilis have red-colored ulcers, known as syphilitic chancre. In the genital area, scrotum, penile shaft, glans penis. It can be on vulva in case of females, and also pubis. Right. So this chancre is like an ulcer, which is filled with those spirochetes inside. So it's highly infective, and as it's a sexually transmitted infection, with the contact of the mucus with the chancre, can infect another person during the sexual intercourse. Okay, so stage 1 in primary syphilis with the chancre usually resolves itself without any treatment in 3 to 4 weeks. But in this case, after 3 to 4 weeks, after primary syphilis, a person develop stage 2, secondary syphilis. And the stage 2 syphilis is a bit more severe. It is characterized with the condylomata lata, which is painless wart-like lesions, like this. It can develop on the penis, on the scrotum, It can develop on the, for example, on the inner thighs and in other areas as well. And there's a maculopapular rash that usually affects soles of feet and hands, palms, and there's a generalized lymphadenopathy. So people affected with syphilis, they're mostly infective in the secondary syphilis period, right? Because even those condylomatollatus are infective as well, if I'm not mistaken. Okay, so after stage 2 secondary syphilis, there are three types of progressions. Either it's complete resolution. I think there still have to be some treatment. As you know, syphilis is treated easily with the benzathine penicillin, so it's not resistant bacteria, so it can be treated easily. So if we treat someone with the stage 2 syphilis, it can progress to complete resolution. It can also lead to complete resolution without treatment in 1/3 cases. In another 1/3 of cases, the secondary syphilis progresses to the latent stage. This is latent asymptomatic stage. So there's no symptoms, but there's spirochetes present, so they're not gone in the serum and genital secretions. So patient in the latent stage without any symptoms still remains infective. Now, there is another progression after stage secondary syphilis. The last 1/3 of cases, patients may develop stage 3, also known as tertiary syphilis. So it can go straight from stage 2 to tertiary syphilis, or from stage 2 it can progress to the latent stage with no symptoms but still infective, and after from 5 to 20 years, patient will develop a tertiary syphilis after the latent stage. So tertiary syphilis is the most severe form of syphilis. It's usually characterized with the meningovascular syphilis. It can be strokes, neurological deficits, and the morphological feature of syphilis is that there is endarteritis, right? Endarteritis, which means that there's destruction of the small arteries and arterioles, and usually all those complications of syphilis and symptoms are caused um, by those damage to the arteries. And for example, in case of the cerebral arteries, the the ones that the vasa vasorum, the smaller arterioles that supply the arteries and also veins, they get damaged. So that's why it causes the problem with the blood vessels. So the most common complication and the symptom of tertiary syphilis is aortitis, the cardiosyphilis, which causes syphilitic aneurysm. It can develop in thoracic aorta most commonly, and it can also cause aortic regurgitation, which is less common. There's another symptom as well, which is neurosyphilis. There's generalized paresis and tabes dorsalis, which is the damage of the uh, dorsal root of the spinal cord, characterized with ataxia, loss of touch, and proprioception. So this is the clinical presentation of tabes dorsalis. And lastly, we have gumas. You see, guma is like this. It's like necrotic area, if I'm not mistaken. It can arise in the liver, skin, bones, and joints as well, right? Okay, so the good thing is that syphilis can be treated in any form, in case of the primary, secondary, and latent, and in case of the tertiary syphilis as well. And luckily, the infection is highly susceptible to penicillins. Okay, now let's talk about the congenital syphilis. So congenital syphilis, the infant can get infected with syphilis either via the transplacental infection during third trimester or transcervical infection during the passage to birth canal. And both of them will lead to congenital syphilis. So in most cases, there's abortion or stillbirth, but the infant can be born. So we have two types of manifestations of symptoms. We have first early congenital syphilis, which is also known as infantile congenital syphilis. This is with onset under 2 years of age. So we have rash, osteochondritis, periosteitis, liver and lung fibrosis, skeletal abnormalities under age of 2, known as infantile. But in the late congenital syphilis, this is for children infected with congenital syphilis onset after 2 years of age. This is characterized with the saddle nose, frontal bossing, short maxilla. Those are all bone deformities, which are really severe. There's Hutchinson teeth, which is a notched, widely spaced teeth. They have mulberry molars, poorly developed first molar teeth. Eyes or nose sensory neural hearing loss. Ragadis, perioral fissures, cracks, and scars, particularly near the corners of the mouth and nose. And there's cranial nerve palsies. This is cranial nerve 8 defect causing deafness. So it's a very severe congenital disorder, right? So it's important for the mother to be aware if she's infected with syphilis and get prompt treatment. Okay, let's talk about other. No, we're on syphilis still. Okay, let's just end the syphilis quickly. So this is the diagnostic values in case of the suspicion of syphilis. Either it will be chancre, rash, lymphadenopathy. In any type of syphilis, either primary, secondary, tertiary. Diagnosis is made with the biopsy with dark field microscope, and then confirmation of the diagnosis is made. So screening with syphilis, we have two types of screening methods. One is non-specific antibody tests, and we have specific antibodies against the specific syphilitic proteins of the treponema spirochete. So non-specific antibodies are against cardiolipin antibody. So those are venereal disease research laboratory test and reactive plasma regain or something like this. So those two are non-specific antibody tests. So if non-specific antibody test is negative, we're 100% sure that there's no syphilis, right? But if a non-specific antibody test is positive, it can indicate a few things. Because for a non-specific antibody test, so this cardiolipin is elevated in case of systemic lupus and also in antiphospholipid syndrome. So we need to make sure that if this non-specific antibody test is positive, we need then to differentiate: is it syphilis, is it systemic lupus, or is it the antiphospholipid syndrome? And also drugs such as hydrolazine and isoniazid can give false positive, right? So then we do specific antibody test, which is FTA-ABS test. So this is specifically against treponemal antigen. And in this case, if it's negative, there's no syphilis, right? If specific antibody test is negative, there's either systemic lupus, antiphospholipid syndrome, or drugs causing increased cardiolipin levels. And if specific antibody test is positive, then we're 100% sure that is the person in any period of time was infected or is currently infected with syphilis. Unfortunately, if it's positive, it can also indicate that the person already recovered from syphilis, either with the treatment or, as you could see here, 1/3 of patients result progress into complete resolution. So we need to make sure that the patient had already had syphilis. He says to the doctor that, yes, I already had a syphilis, so specific antibody test will remain positive. And if the patient is complaining of those symptoms with the primary, secondary, tertiary, or syphilis, then and it's positive for the specific antibody test, is definitely active syphilis. Oh my god, I'm tired. Okay, now let's get to the other genitourinary tract disorders, system disorders. There is a chancroid, which is also known as soft chancre, caused by Haemophilus ducreyi. This is a causative bacteria causing this disorder. It's frequent infection with the patients affected with HIV. Symptoms include painful soft red ulcer, painful chancre, and also inguinal lymphadenopathy. And lastly, we have, not lastly, we have granuloma inguinale, caused by Klebsiella granulomatis. It was formerly known, this Klebsiella, the name of it wasn't Klebsiella, it was something different, but it's Klebsiella species, so they now call it Klebsiella granulomatis. Granuloma inguinale symptoms include lymphedema of the inguinal and femoral region, elephantiasis, and morphology, which is high yield, is Denovan bodies. So morphologically in the microscope we can see Denovan bodies, which is indicative of the granuloma inguinale caused by Klebsiella granulomatis. Okay, now sexually transmitted disorders of the protozoal infections are Trichomona vaginalis, which causes trichomoniasis, and viral infections include hepatitis B and C, HIV, herpes simplex virus, which can be genital herpes caused by HSV2, or it can be HSV1, primary lesion, painful vesicles and rash of the genital area, secondary lesion reactivation, milder symptoms with similar manifestations. Usually if HSV1 is transmitted during the oral intercourse from the patient's infected mouth to the genital area, it can also cause genital herpes. So HSV1 can also be causative agent for the genital herpes. And lastly, we have papillomavirus that we already know. It can cause penile cancer in men. It can be invasive or non-invasive penile cancer. Okay, that was all. Bye. Shit.